So, what
Yeah.
do you think about getting pregnant during times like COVID and pandemic? Do you think it's really a good idea to plan for a baby, or
Yeah.
what are the factors to consider?
Yeah, no, I think it's a great question. And I think there's a number of factors with that. So, mothers are increasingly worried with COVID and, how, first of all, whether we can get pregnant, whether it's safe. So, what we do know is that uh, uh, it, women should still get pregnant. I would not say COVID is a reason not to get pregnant, but obviously you have to have a lot more precautions in place when you're getting pregnant. All right. We've in Australia in particular, and I think it's not just Australia. We look at the sort of developing world as per se, and they're looking at guidelines. There's quite good guidelines on what you should do. So I think it's all very sensible things. You get pregnant, but it's not to say that pregnancy is safe as per se. It's just a slightly higher risk for mothers who are pregnant when they get COVID, because in pregnancy
Yeah,
you have changes to your immune system and also to the way you sort of breathe, which can sort of make you more prone to viral illnesses like COVID. So, we get a bit worried, especially in the third trimester. But, the sensible things you'd want to do is, make sure that you follow physical distancing, have good hygiene, make sure that you're keeping your own safety bubble, with people that you're sure of who are not infected. Those are main things
yeah,
that you would be trying to do. And, I think another big thing that's come out of Corona is also, we've already seen that women tend to have a higher level of stress and anxiety because, their social networks are not the same. There's more worry. So it's something we
yeah,
need to keep very sort of be mindful of, because I think we all need to pay attention. This is something we always forget, right? Health and wellness is not just about your body being okay, it's about your mind being okay.
absolutely.
Yep, health is
Mind as
mind and
well.
mom. Exactly.
Yeah,
So I think that's a key part about it, because you need to actually put effort into that. Move to newer platforms. Like online platforms, online mothers groups. Keep abreast of the latest information. All right. And another question that mothers always have when they talk to me is, what's the chances of my baby getting COVID? So we know that COVID itself, there's some cases in the world where it's been what we call transuterine, which means that it's been passed from the mother through the uterus, through the placenta to the baby. And that's really rare. So I wouldn't be worrying too much about that.
okay,
It can happen, but it's really rare. The more common way, and what people know
okay,
how it's passed is, when the mother has COVID and she's in close contact with the baby and the baby
okay.
gets it. All right.
Yeah,
So that's where we really, again, the same things apply. You need to make sure you're safe. And if you're having symptoms, get tested, be very vigilant, because we know that babies and children can get this. In children, there have been some different forms of disease, some new studies that have just come out that show that, infected neonates or, babies, as per se, can have some severe form of the disease. So that would be my advice at the moment. Did that make sense? Or was there something else in there?
yes, yes, it did. Yes, yes, yes. So we can get pregnant, but just be mindful is the whole summary.
Yes, yes, of course. I don't think people should stop getting
Yeah.
pregnant. I don't think there's some interesting studies that show that preterm birth rate has already gone down, which I think you guys have already
Yes,
covered
have
very
reduced.
well.
Yes.
Yes,
Yeah.
so that's
Yeah.
that's interesting. They think it's either related to less infections in mothers or the fact that mothers are not so stressed. So obviously, it comes
Yes,
back to the
yes.
same thing.
So that's great. So stress and trying to get pregnant. So stress, there are like various factors involved when it comes to when someone plans for a baby. It could be food or lifestyle or various other factors. But the core essence of baby making, that is the intercourse or sex itself, becomes stressful because of the fact that it's going to be scheduled sex. Because if I'm going to plan for a baby, then it's going to be like, okay, this week I'm fertile, and by today, like 6 p.m., I have to have sex. I'm ovulating only until then. So the whole process has become really stressful. Like even sex has become stressful. But what I feel is that we're creating a life, and we need to be really happy about doing it, right? So my question to you
Yeah.
is, how do you think? What is the role of mind while trying to make a baby? While having sex. So, what do
Yeah.
you think about it? Yeah.
Yeah, I think Look, I think that question is a very relevant one. I think you're talking about women in general trying to get pregnant, and there
Yes,
is.
yeah, a
So
couple
this
in
is a bit of a
general.
chicken.
Yes.
Yeah, this is a chicken and egg story because realistically, there's some studies that sort of show that women who have trouble conceiving have a high level of stress. We don't know whether that's because they're stressed because they can't conceive or because they're stressed they can't conceive.
Yes,
So we don't really know
it's
the
true.
answer to that. But I mean, generally dealing with patients themselves, I mean, it's very obvious that trying to get pregnant is a really stressful time in one person's life because it's not just that physical part of it, but there's that whole societal aspect to getting pregnant as well, where you're sort of judging yourself by your peers in a way. There's some scientists who I've heard, prominent ones who say that for a woman, motherhood is like part of the norm. So when she's not able to get it, it becomes abnormal suddenly, and that's a mental thing that you need to get over. So it can be stressful. But the question here is, if you're a young woman, who's trying to get pregnant, you know, don't put that stress on yourself because we know from studies like what you're saying that, it does impact fertility or the ability to conceive. And the last thing is, I'm the other part of it as well is it really affects the relationship itself. So that two part of it, you really need to be
True.
mindful of that because, it can come, you
Yeah.
don't want to come out having a baby and then you're having problems with your partner as a result of that. So
Yeah.
again, it's something that
Yeah.
women actually need to think about because at the end of the day, you want to have that tight relationship as well that you're grooming for that baby, right? And well, what we do know
Mm.
from other studies is that pregnancy itself, is the time where women have the highest level of domestic violence and quite a high level of relationship
Okay.
breakups as well. So a lot of these factors play on to that, and
Sure.
none of these things are
Mm.
acceptable, but you can understand where it might stem
Mm.
from. So I think it's very important that you have a positive attitude and try. Obviously, if you're having a medical condition,
Mm.
it needs to be treated. That's a different thing. You need to see a doctor, and
Yes.
if you're
Yes.
older, above the age of
Yeah.
35, etc. That's something you actually want to go and do in a timely manner. Okay.
Yeah.
Yep.
Mm. Yeah. Thank you. So, talking about infertility, like if you see predominantly, if a couple is married and then they're not pregnant, it is very common for the society to blame the women for her infertility. But I feel often they forget that there are two players involved in the game, right? So there's even the man in the relationship and he has a role to play. So nobody talks about men's infertility here around. Probably that doesn't strike them first. So I would like to know what is the ratio of men's infertility versus women, or what are the factors that could cause to infertility in men or having troubles with having making a baby.
Yeah,
So
no, it's a good question. So there's a the number is not that uh, sort of locked down. I mean, it sits somewhere around 30%, but that's depending on whether you're looking at a unexplained infertility proportion or whether you're looking at people who are trying to get infertile who are being investigated. But it's about 30% where you see men having some level of infertility related issues. And you're very right in saying that.
oh, that's quite less, right?
Right? That's quite
That's very less number.
in
Yeah.
comparison to what? What do you mean? Less than women, is it?
So yeah, less than women.
Yeah,
Is
no,
that
look,
right?
I think the best way to look at it is that there is a high proportion of people who have unexplained infertility that you don't really know what's causing it. And a lot of this comes down to both parts of that equation as well, which is really important to understand. Infertility investigation cannot be done with just women alone because of the fact that there are quite a number of
True.
mixed factor problems. We investigate the women a lot, and this is also comes down to the fact that as men don't seek medical help for a lot of things. This is the problem. So
Exactly.
and
Yeah.
male,
True.
yeah, and that's another reason why it's not really investigated well. Like for instance, female infertility is a specialty on its own in obstetrics and gynecology in particular. But male infertility, no one, unless you actually have an interest in it, no one really does it. But it's a key part of it because you actually need to check the man's sperm, which is usually the investigation is that. But there can be, you know, chromosomal disorders, basically genetic disorders in the man that can actually
Yeah.
contribute towards this. And the worst part is if the men have those, like something that's called Y chromosome microdeletions. The worst part is if the men actually have it, their children will have it as well. So it's creating if you have a boy, essentially it's a whole lifelong IVF that you're signing up for, because they will never be able to have a child as well. So it's very important that you actually look at these things, because it can have repercussions. The other thing is also, to overcome that, you probably need basically like uh, therapies. So there are surgical therapies that you can use to overcome it, which I mean, I don't want to go into detail because that can become a talk on its own.
Yeah,
But
yeah, yeah,
yeah, but I think
yeah.
in general, the male factor in fertility is quite significant. And I don't think people should underplay it. And I think this is very cultural as well. I mean, my own background is I'm Singaporean. I've come to Australia, and I've had the privilege of seeing both sides of the spectrum. And I see that I don't know why there's this blame aspect, because it's a bit funny when you say someone is responsible for something they want
No,
anyway. Because
yeah,
I don't think it's you. No, I'm not saying it's you. I find it funny that society feels that way, because I don't think any woman wants to be infertile. It's something it's like
exactly.
a problem that someone has, and we're
Hmm.
trying to help them reach that point of having that baby.
Yes, yes.
So,
It's just the mindset of the people. Like the number of patients who come to you probably. So probably female are more than men, right? So when someone's trying to get pregnant, the first thing is they just think that the female needs to be treated. She needs to be taken care, and she needs to. They completely forget about the man aspect to it. So it's just the mindset of
yes,
the
yes.
people. Yeah,
Yeah, no, absolutely. It's
that's
both.
right.
In Australia, both people are investigated thoroughly. So it's not, because we know a
Okay.
significant amount of this can be male factor related or unexplained or
Mm.
both. So it's not just the female, I can
Yeah,
tell you that much. So you're very right in saying that.
yeah.
Yeah.